Hi everyone. I'm sorry that I am so hoarse after having the breathing tube in from having surgery a few days ago. And so this video quality is pretty bad, but that's because it's late at night. And again, I promised that I would give y'all an update after surgery or within a few days of me having surgery. So bad quality video. I'm not feeling so well. I've been in a lot of pain, but I wanted to share one of the nightmares that occurred with me with the anesthesia at the time of surgery. Totally unexpected. It was horrific. And anyway, for those of you who don't know, about 12 days ago, I fell and I fractured my left foot and I broke 3 bones in my right ankle. So because of the swelling being so bad, they could not perform surgery until some of the swelling went down. That took place 3 days ago. I went in for the Orif surgery where they had to put in 2 plates on both sides of the left ankle, as well as I don't know how many screws. I know there were 9 screws on one side. Right now, I don't think you can see it, but both legs are still casted. I'll try and show you if I can. Try to shine the light. This one is now just a soft cast, an air cast during the day with an ace bandage at night, and then this one is the full works, and those stitches are going to come out in another 12 days. The pain has been excruciating, but I've been able to manage. But beyond that, I had an experience with the anesthesiologist just before going to sleep. They put the mask on me that where you breathe in the gas that puts you to sleep, and they kept telling me to take a deep breath and get the oxygen in your lungs so that we can get the medicine in you, and that'll make you go to sleep. And so I took a deep breath, and then when I went to take another deep breath, suddenly everything locked up on me. I went literally, my mouth, I couldn't open it. I could not move my tongue. I couldn't move my body. I was fully awake, and I was looking right at the anesthesiologist, but I couldn't talk. I couldn't breathe, so he kept saying, take a deep breath, relax, it's okay, and putting his hand on my chest for me to calm down, and he said, take a deep breath. And I looked at him like, I was giving him that face, and I was intentionally making my eyes super wide for him to see that I was horrified and that I couldn't breathe, and I wanted him to get what I was saying. And so I felt like I was suffocating, and this probably only went on, sorry you guys, this probably only went on for I don't know, 7 8 seconds, but it seemed like minutes to me because it was unexpected. They were just telling me to breathe, and then I'm still wide awake and a little bit nervous about the surgery itself, not expecting to go to sleep at that time. And all at once, my body is just like having an out-of-body experience, sort of. Like, what do they call it? The paralysis, sleep paralysis. It's as if my body went into sleep paralysis from my neck down. But I could still move my lips. However, I couldn't breathe. I couldn't move my tongue to put it down to take a breath. I couldn't talk. All I could do was move my head a little to shake it. No, I can't breathe. And to move my eyes as if, to panic to him, I can't breathe. So it wasn't until I just knew that was how I was going to die, right in front of the surgeons and the doctors and laying on an operating table. I was sure that was it. I'm going to die by suffocating to death. And that's the last thing I remember. The last thing that I remember regarding that was me trying to gasp to get the air in and making the face at him with the big eyes to try to make him recognize that I could not breathe, and then everything went dark. I didn't remember anything else until I woke up. So that was the thing that stood out the most for me, more so even than the surgery, because it was horrific. Prior to the surgery, they decided that they wanted to do a block. It's a nerve block that completely numbs the lower part of my calf on down through my toes for 24 hours. So they had to take, and I was fully awake for that, and didn't have anesthesia or numbing medication, and they had to take a tube that was about the size of an ink pen on the inside, the ink part of the ink pen, inside of the ink pen. That's how big that tube was. So I had to turn the bad leg over, of course, with all the broken bones in it, and they had to go in through the back of my knee while I'm fully awake. They needed me to feel this to make sure that when they hit the nerve, it wouldn't feel like an electric jolt, because they did not want that. They wanted to put I guess it's a steroid medication or something, inside there to block that nerve off from allowing me to feel pain. Well, needless to say, all of that extra pain also was for nothing, because it didn't work. He missed the nerve that he was going for, and it was extremely painful. That procedure was extremely painful. It left 2 holes in my leg. I'll try and link that in the video here too. And then it was after that that they took me down for the surgery. And I think my leg from those holes and my throat are more sore than I am from the surgery. I've been having a lot of pain in the leg, but the horror of not being able to breathe and not being able to communicate that I couldn't breathe, that was like oh my goodness, that was a fear that was beyond description. Other than that, I want to thank all of you guys for your support and for your prayers. And I'm really missing not being able to work. I work, for those of you who know me, I work every day, 7 days a week, 12 to 14 hours a day as a driver. And I've been bedridden now for 12 days. 12 days, yeah. So I'm pretty miserable, but wanted to update you guys. You were all asking for an update. Hopefully I'll have a better quality video to put out for y'all in the daylight when I'm feeling a little bit better over the next few days. They are going to have to change the cast for the 4th time within the next few days, because my body may be rejecting the metal that they put in to the ankle, where I'm having some problems in that area. I won't find out until tomorrow regarding that. But again, I wanted to at least come on long enough to update everybody and to thank everybody so much for your support, your love, your comments, and your prayers. And I'll talk to y'all again soon. And thanks for bearing with me with this hoarse voice and bad quality video. Thanks for your support. Take care, and much love to you all.